Hello, I'm Dr. Heiner. I'm a urologist and I've prepared this video clip to talk a little bit about the robot-assisted laparoscopic radical prostatectomy, or DaVinci prostatectomy. That's an operation that's done for prostate cancer. The goal of it is to remove the entire prostate gland. The prostate gland sits below our bladder, right here, and its purpose is to make semen. The prostate can develop cancer, and one treatment option for it is surgical removal of the prostate. You'll also notice that the urine has to flow from the bladder through the prostate and out the urethra, out the penis to the outside world. When we remove the prostate, there's a gap in the plumbing, so to speak. A section of the pipe is missing. So we sew the bladder neck down to the urethra here to make that intact once again. After an operation to remove the prostate, a catheter is left in the bladder, draining the urine for about a week to 10 days. And that acts as an internal cast in order to let the urine come out to the outside world and not leak out in between into the pelvis in between the stitches where we sewed the bladder neck to the urethra. The DaVinci prostatectomy, or DaVinci Robot, is a tool that we use in the operating room. It allows us to more easily do laparoscopy. Laparoscopy is a surgical technique which involves a small handful of incisions, tiny kind of gunshot-sized wound incisions, as opposed to big, larger incisions. And that can, for some organ removals, decrease their recovery time and improve their quality of life. The DaVinci prostatectomy allows the surgeon to see better in 3 dimensions with magnification, and it's the most popular way to remove the prostate now since laparoscopy has advanced so much. People that have their prostate removed can expect to spend 1 or 2 nights in the hospital. They are able to go home after their pain is well controlled. They're tolerating enough by mouth, meaning fluids and food, to keep themselves hydrated and nourished, and they're getting around okay without a lot of help, and they feel like they're ready to go home. For some people, that's the day after surgery. For most, it's 2 days after surgery. Things that people will notice after a prostatectomy is that they will no longer have semen. They may have orgasms and feel like they're ejaculating, but no semen comes out because the prostate that makes the semen has been removed. Some men, after the catheter removal, will have trouble controlling urination. In fact, 50% of men, when we remove their catheter, have excellent continence, meaning urinary control. The other 50% of men leak urine to one degree or another. Some people, it's just a few drops when they cough or sneeze or lift something heavy, or when they stand up from a sitting position. Some people, they're having urine dripping out of them quite severely and are not able to hold any urine at all. But that usually improves over the course of a few weeks to a few months. For the vast majority of people, that gets better. There's about a 2 to 5% long-term risk of urinary incontinence, which means that a year or 2 later, men are still leaking urine. Some of them, it's just when they get an asthma attack or they get a cold and they cough a lot, or if they're going to lift something heavy or help somebody move and be lifting a lot of things. And so for most men, it's not a nuisance. But for a small minority of men, perhaps 1 or 2%, it's a bad enough problem that they need to have another operation down the road to fix their incontinence. Another complication of treatments of prostate cancer, including surgery, is erection troubles. The nerves that cause the erections run down along next to the prostate, kind of here on the left side and the right side of the prostate. And if those nerves are removed during surgery, along with the prostate, then that could make people impotent or unable to achieve an erection. Usually we can peel the nerves off of the side of the prostate and leave them behind and just take the prostate out in what's called a nerve sparing technique. That helps men achieve the return of their erections. Usually within 12 to 18 months, the erections have returned. For some men, it's a lot sooner than that. Part of life is the deterioration of our erections. So most of us notice that the older we get, the worse our erections get. But certain treatments for prostate cancer, including surgery, can have detrimental effects on the erections. With nerve-sparing techniques, sparing the nerves, that can help the return of erections. Some people also think that it can help with continence by sparing the nerves. Whether or not we spare the nerves depends on how aggressive the prostate cancer is and how safe it is, because the nerves lie right next to the prostate. If some cancer is eating its way outside of the prostate, the first place it might go is into those nerves. So we have to be judicious, because if we leave those nerves behind and there's some cancer in them, then we're leaving some cancer behind. That's not something we can see with our eyes, or even with a magnification from the three-dimensional image of the DaVinci Robot. Often it's a decision we make intraoperatively. If we're trying to peel the nerve off of the prostate and it's not coming easily, then sometimes we make a decision right there whether or not to just remove the nerve with the prostate, because first and foremost it's a cancer operation and we want to remove all of the cancer. We don't want someone having cancer left behind with the consolation that at least they're getting an erection. And now, even men that get no erections can have excellent return of erection function with the different treatments that are available. That's a little bit a description of the DaVinci surgery. There's usually about 5 to 6 small holes along the abdomen, on either right next to the belly button, and also along either side, fanning out towards the side of the body from the belly button. And if you have any more questions, feel free to ask us those when you come in to see us in the office. Thanks.